Hi everyone, my name is Nathalia Castaneda, and this is going to be my presentation on child-centered play therapy and why we should be using this in our department. So to get started, the name of the model is child-centered play therapy. And this is basically a therapy approach where that it's believed that things must be internalized and lived out, meaning that the child must um, internalize it and then act it out or play it out, which we'll discuss a little further into the presentation. One of the major theorists is Virginia Axland. She was a student of Carl Rogers and later became a colleague of his. And she basically effectively operationalized the philosophy and principles of Rogers' non-directive, person-centered theory for application in relation with children in play therapy, which essentially she believed that we created a safe environment for children, a safe and judgment-free environment for children that they could use play to process their emotions, thoughts, and experiences. Other key figures include Carl Rogers and Gary Landreth. So the main epistemology and theoretical assumptions of child-centered play therapy is that a child's natural language is play. And this basically means that they express themselves, like their thoughts and their feelings and their experiences through play. Um, they also build their understanding of the world through these experiences and interactions. Another main component of this is of child-centered play therapy is that children are active participants in their own growth and healing. And therefore, as the therapist, it's our job to support the child and help facilitate that growth and healing and not direct them, but be there as a guide. Um, this theory is based on the belief that children also have an innate capacity to strive towards growth and maturity. So the major concepts of this theory is that a child's perception of reality has to be understood first in order for us to understand their behaviors that they're exhibiting. The next main concept of this theory is that the presenting problem is understood by focusing on the child's perspective and using play as a form of communication. So once again, play is just the child's natural language in which they express their emotions, thoughts, and experiences. And therefore, as therapists, it's our job to facilitate a safe space where they can express these thoughts, feelings, and emotions. And it's also our job that in therapy sessions, the child is leading these sessions, and we're just there to observe and interpret their play in order to give us insight onto what their perception is and what their problems and challenges are that they are facing. This theory focuses on patterns which are found across multiple sessions in the child's play behavior and emotional expression. Um, and another major concept of this theory is that a functional parent-child relationship is where there's an emotional connection between the parent and child, and the parents learn to communicate with their children through play. Um, and also, the parents must acknowledge that their child's autonomy and also respect their independence and ability to direct play sessions. So once again, the child is leading the play sessions. It's not the parent, not the therapist, it's the child, and we're just there to observe and interpret these play sessions. For child-centered play therapy, selected toys, materials, and the reasoning for it are as followed. Main component would probably be art supplies, which include pens, pencils, colored pencils, paint, markers, paper, construction paper, scissors, basically anything that the child can use to create, draw, or do anything creative. The budget for this would be about $50, and the main reason we'd want to do this would be so that the child can express themselves through either their art, writing a poem if they're a little older, or writing song lyrics. So this is a great way for a child to be creative and express themselves and express any internalized thoughts or issues and experiences or feelings that they're having. The next type of toys that we would get would be narrative toys, which is basically anything that can help a child tell a story. Um, this can include like puppets, dolls, action figures, stuffed animals, doll houses, little toy cars. The budget for this would be about $40. And once again, the main reason is so that the child can express themselves through story and narrative, and they can um, tell and have something visual as a representation of that story. And lastly, we would do active aggression toys as well, which are basically toys that help release pent up frustration and energy. These toys include things like bop bags, fidget toys, foam swords, or inflatable hammers, things that can't hurt the child, but that they can use, to let out any pent up energy or aggression that they may have. And the budget for this would be about $45, and in total, everything would cost about $135 for these selected toys and materials. The ideal therapeutic space size that we would like to get for this would be a 12 foot by 15-foot room. And we could possibly lower also the cost of any furniture items that we're getting by shopping at discounted stores like an outlet, or using secondhand items through sites like Offra, Facebook Marketplace. Um, the therapeutic space would include a child's table with 2 to 4 chairs, a toy bin organizer, interlocking foam floor playmats, where a child can sit and read or play with toys. And we would also like to include pillows, once again, for the floor playmat area so the child can sit and relax. And also a kid's bookshelf with books um, or toys used to in place therapy sessions. Total cost about all of this would be about $165. So in total for the toys and materials and the therapeutic space and furniture would be about $300. So the focus of interventions in child play centered therapy is um, that there's an emphasis on the child's current emotions, thoughts, and experiences. The order of change that occurs is we strive for second order of change in child-centered play therapy, because these are where the long-lasting results will be to the child's emotional and behavioral well-being. And as far as affect versus behavior versus cognition, the goal of child centered play therapy is to address the child's experiences and emotions. Secondly, it's to address the underlying emotion that will likely cause behavioral changes. And lastly, it's cognition, which focuses on gaining some insight into the child's experiences, feelings, emotions during the play sessions. The therapeutic emotion orientation for child-centered play therapy is emotion-oriented therapy. And basically the core focus of this is exploring and understanding the child's emotions through play. We also focus on using play to help the child emotionally heal and grow. So the treatment process in child-centered play therapy is as follows. The initial treatment is going to be doing the initial assessment and intake, which is basically gathering information and meeting with the parents or guardians for an initial intake session to discuss any of the child's behaviors or emotions or challenges that they want to address during the therapy sessions. Then we start with the play sessions, where in each session the child once again is leading and engaging in free play, where they're expressing themselves. And the therapist is following and observing, and also will occasionally make reflections. Um, and this is also where the therapist can set limits, usually to prevent any harmful behavior, such as like destroying toys or materials or hurting others. And the next part of the therapy session is the therapy termination stage, which is basically where the therapist determines the end of therapy just due to the child's progress and readiness. The therapist will then initiate the gradual closure of therapy. And then after therapy, there can be some post-therapy follow-up sessions if needed, and also just support after the therapy sessions have concluded, in order to just assist the parent if there is any other issues or just follow-ups that the parent wants to discuss. It also is important to mention that this therapy is recommended for children ages 3 to 12. It can be adapted for older children, but this is the recommended age. The length of treatment on average is about 20 play session therapies, and each session lasts about 30 to 15 minutes. So the types of clinical interventions in child-centered play therapy is that it's child-led. So basically, once again, the child is leading the sessions. The therapist is just there to create the safe environment and observe and listen to the child. Um, it's important to note that we're not interpreting or analyzing the child's play behavior. We're just there to observe and listen. And the therapist can also just suggest activities like playing with certain toys, dolls or art supplies, sand, or like Play-Doh. And in this therapy, there is also the component where the parent or caregiver can engage in joint play, where once again, the child is still in the lead. The parents are just following, the parents or guardians are just following and doing what the therapist basically would be doing in that role as well. There is no homework for this type of um, theory. It is just mostly through the therapy sessions, but the therapist can make suggestions of activities that the parent or caregivers can try outside of sessions just to help the overall therapeutic process. So, one of the great things about child centered play therapy is that um, it can address issues of diversity, privilege, or social location and take these aspects into consideration. A lot of it is going to be based on the therapist's knowledge and skill base of adapting and incorporating these aspects into the therapy session. So, for example, if a child recently immigrated from Mexico, the therapist might want to get toys or supplies that the child is familiar with so that the child feels more at ease and comfortable during the session instead of the child trying to figure out these types of toys that they've never seen before. It is important to note that the therapist should be sensitive and aware of the child's culture, social location, privilege, social class, spirituality, and just understand the family dynamics in the household, just so that they understand how this could have an effect on the child's experience and how they may show up and represent themselves through play. So, there are some legal and ethical considerations to consider, such as privacy, confidentiality, and informed consent. Because the child is going to be a minor, or is likely going to be a minor, it's important that the client's parents or guardians understand privacy and the limits of confidentiality concerning what is said and done during sessions. And it's important to also get informed consent from the parents or the client's guardians. It's also important that the therapist knows that they're mandated to do any reporting um, if there's any signs of abuse, neglect, or even issues of like self harm that the client may be um, exhibiting. It's also important for the therapist to respect multicultural backgrounds and family values. So the therapist should respect any cultural differences and family values that the clients may have and be aware of any biases that they may consciously or subconsciously have, and to do some self-reflecting and um, be self-aware so that they're not bringing these biases into the therapy sessions with clients. And lastly, it's important that the therapist set boundaries in order to maintain professional boundaries with the clients in order to establish trust and foster a safe environment for the client. So, for child centered play therapy, there are some telehealth alterations and recommendations that we can do to make this more accessible to everyone, especially those who can't come into the office or into the therapy session rooms. One of the biggest factors in this is going to be getting parent and guardian involvement with telehealth. So some of this would include explaining the expectations that we have of them as being their parent or guardian, such as providing a space that the client can do the sessions in, and having the supplies or toys needed per session. Possible locations could be like the kitchen table, living room, or child's bedroom. Toys and supplies can be as simple as paper and pens and pencils, just to make this more accessible. And we can also discuss with the parents if or guardians that if they don't have these supplies, we can discuss maybe creating a package where they can come and pick it up at the office, or we can send it and mail it out to them before the session so that they have these supplies needed for the therapy session. Um, we also would need parent involvement, parent and guardian involvement in case the child gets distracted during the session or leaves the camera view. Basically, the parent can be there to kind of keep the child in the therapy session and engaged with us. Um, we can also just, going along with that, discuss any alterations that need to be made or adjustments, such as possibly increasing the number of session frequency, but decreasing how long each session is, just to account for the child's attention span not being as long as it would be in a live session. For some more additional research, I've listed 3 articles that discuss the benefits and the effectiveness of child-centered play therapy for different types of youth, such as those who have experienced trauma or those who are among marginalized children, and also how it can benefit children physiologically and therefore help them build secure attachments. So these are just a couple of the articles that I've included in this presentation. So overall, the reason that I recommend child-centered play therapy is because its main components are it's that it's child-led, it's an adaptable and flexible therapy model. It can be very inclusive and can be culturally adapted to the client's needs. And it also just helps build the client's skills and confidence. Um, and I believe that it can just make a huge impact in the lives of families as well as just the overall community as a whole. Um, so therefore, I definitely think this is a therapy that we should be incorporating into our department. And then lastly, just to conclude, these are the references that I used for this presentation. And I would just like to say thank you so much for watching, and I hope you all have a great day.